Одного ранку, ще на світанку, земля здригнулась і враз закипіла наша кров, ракети з неба, колони танків і заревів старий Дніпро.
Today, we're diving into an incredible story of medical innovation that's happening right now, born from the crucible of conflict. We're looking at a recent study that shows how surgeons in Ukraine are using a really groundbreaking technique to rebuild faces that have been devastated by the unique and terrible injuries of modern warfare. I mean, just think about that question for a second. It's a huge one, and it's a question surgeons are facing with more and more urgency. When a blast injury literally erases a person's features and destroys the very structure underneath, where do you even begin? That's the core challenge we're going to explore. Okay, look at this scan. This right here, this is the devastating reality. The conflict in Ukraine has caused a surge in these really complex facial blast injuries. And these are not like typical trauma cases you'd see in a civilian hospital. We're talking about a massive, three-dimensional loss of both bone and soft tissue on a scale that pushes surgical skill to its absolute limit. So, to really understand the solution, we first have to get our heads around the unique nature of the problem. These combat wounds are a completely different beast for surgeons. And what the study shows is absolutely key. Almost 86% of these severe facial injuries come from blasts. See, unlike a bullet, which might have a more defined path, a blast wave creates this widespread, totally unpredictable damage, just tearing away huge sections of tissue. So the takeaway here is that these wounds are, well, they're messy. The medical term is avulsions, which means large chunks of skin, muscle, and even bone are literally ripped away. And to make things even worse, you have a high rate of contamination from the battlefield, which leads to these severe infections that make trying to reconstruct anything right away pretty much impossible. All of this, it creates a perfect storm of surgical challenges. Rebuilding a face under these conditions means overcoming a whole series of massive hurdles before you even make the first cut. The surgeons are really facing an uphill battle. For starters, the holes they need to fill are completely irregular. The blood vessels they need to connect to are often damaged or have been tied off in earlier life-saving procedures. Get this, almost half the patients show up with infections already present. There's widespread scarring from the initial blast, which makes the tissue tough and difficult to work with. And on top of all that, there's a huge delay. We're talking a median of 157 days between the injury and the reconstructive surgery. That's a lot of time for scar tissue and other complications to set in. So, with that whole list of challenges, what's the answer? Well, surgeons needed something that was versatile, really robust, and super reliable. And they found it in a technique called the anterolateral thigh flap, or as we'll call it, the ALTF. The easiest way to think of the ALTF is like a living, self-sustaining patch. Surgeons can take a whole section of tissue from the patient's own thigh, skin, fat, the works, and, here's the magic part, they take it complete with its own artery and vein. This flap is then moved up to the face, and its tiny blood vessels are meticulously reconnected to a blood supply in the neck. This allows the new tissue to live and become part of its new home. Now, this whole process demands incredible precision. It all starts with carefully mapping everything out on the thigh. Then, the surgeons dissect down to isolate the flap's lifeline, that tiny artery and vein that'll keep it alive. Only then can they custom shape the tissue so it perfectly matches the three-dimensional defect in the face. So you might be wondering, why choose the thigh flap over other options? Well, if you compare it to a more traditional choice, like a flap from the forearm, the ALTF has some huge advantages for these massive combat injuries. First, it just provides more bulk, more volume to fill the huge craters left by blast waves. But maybe just as important, the impact on the donor site, the leg where the tissue is taken from, is minimal. This means less pain, a faster recovery, and better mobility for the patient. And for military personnel, that difference is everything. And this isn't just theory, right? A dedicated team at the Kyiv Regional Hospital put this exact technique to the ultimate test, performing these incredibly complex reconstructions under the extreme pressures of wartime. Okay, so let's take a quick look at the study itself. It followed 21 patients. They were overwhelmingly male, with an average age of about 37, and this was all tracked over a one-year period. So this gives us a really clear focus window into how this technique performs in the real world. And to really understand the context here, it's vital to know that over 90% of the patients were military personnel. This research is a direct response to the human cost of this conflict, and it's aimed at restoring not just function, but identity for those who have served. So the big question is, with all those challenges we talked about, the infections, the scarring, the long delays, how did the ALTF actually perform? Well, the results are, frankly, nothing short of remarkable. A 90.5% success rate. Just let that sink in for a moment. Under some of the most difficult surgical conditions you can possibly imagine, 19 out of 21 of these complex living patch transplants worked. It's a huge testament to both the skill of the surgeons and the incredible robustness of this technique. And that success rate is even more impressive when you look at the details. The 2 failures that did happen, they happened during the surgery itself, not days later. This meant the surgeons could pivot immediately and use a different flap, ensuring that every single patient left that operating room with a successful reconstruction. And the immediate impact is just dramatic. On the left, you can see the devastating soft tissue defect after the wound has been cleaned up. On the right, just moments after the surgery is done, you see how the ALTF has provided this robust, living foundation for the face to be rebuilt upon. And this is the healing journey. At 1 month after the operation, you can see the flap is still a bit bulky, but it's clearly integrated and healthy. But then, look at the image from 2 years later. The tissue has settled, it's become a natural part of the patient's face, restoring contour and form. And that right there, that's the goal, a lasting, stable reconstruction. The title of the study is War as a Teacher. It's a pretty somber thought, but it's fitting, because the lessons being learned here are going to advance reconstructive surgery for everyone. So what's the bottom line here? The study basically confirms that the ALTF is an incredibly reliable workhorse, even for the worst-case scenarios. It provides that thick, healthy tissue you need to cover bone grafts or implants. It works even in infected and scarred wounds. And because it has such a minimal impact on the donor leg, it's really the ideal choice for this specific group of patients. What really began as this desperate challenge on the battlefield has led to a powerful, refined solution. This technique isn't just patching wounds, it is genuinely restoring lives. And while these lessons were born from conflict, they're going to have a lasting impact, improving outcomes for complex facial trauma everywhere. I'll just end with the study's own powerful conclusion.
Русні не буде, і буде мир на всій землі. І скоро зовсім русні не буде, а буде мир на всій землі.